May is Maternal Mental Health Month. Over the last couple of years, I've discussed this topic with a variety of guests, and it is near and dear to my heart. But this year, I wanted to incorporate some other unique perspectives on this very important topic. Today, you're going to meet Dr. Nicole Rankins. Dr. Nicole is a board-certified practicing OBGYN and mother of two. She helps first-time moms get calm, confident, and empowered for pregnancy and birth. And she is very forthcoming with me today about the training OBGYNs receive around maternal mental health, the role that they can play, and what reasonable expectations expecting and new moms can have. All right, let's dive in. Hi, I'm Allison Egidi, a pediatric sleep and wellness coach and a mom of two. I love to help parents find solutions. This is How Long Till Bedtime. Hi, Dr. Nicole. Thank you so much for joining me today. I'm really looking forward to having this conversation with you because, as I know you know, it is believed that at least 1 in 5 women struggle with postpartum depression or anxiety, and it is the number one complication of pregnancy and childbirth. And during this critical window, the OBGYN or their baby's pediatrician may be the only doctor that a mother is actively visiting with. So I'm really looking forward to hearing your perspective on a topic that is really important to me and I think growing in importance nationally. But before we dive in, the first question I always like to ask my guests is what inspired you to pursue your vocation and then to start your business?
Yes, so I guess go all the way back. Well, first off, thank you for having me. And I'll go all the way back to when I decided to be a physician. That was really just a message moment. I was a college student. I was studying mathematics and mechanical engineering, actually. And I was in the dorm, in the bathroom, and I looked in the mirror and I saw myself wearing a white coat. And from there, the spark in my head was, you should go to medical school. And I just kept listening to that voice and then ended up going to medical school. And in medical school, I knew I wanted to do something like procedure-wise where I could work with my hands. I knew I didn't want to do like internal medicine or family medicine. Those are great, but I wanted to do things with my hands. And so it was either general surgery, like a surgical subspecialty, or OBGYN. And in the non-OBGYN fields, I hated having male patients. And so I decided OBGYN is where I should go. And then as far as what I do online, and I still practice in the hospital as an OBGYN, but as far as like my podcast and what I do online on social media and Instagram and things like that, that just came out of wanting to be a source of evidence-based, holistic information that really centers the person giving birth, but is from the perspective of a physician, and just a even keel, honest take on what it's like to give birth in America in a hospital birth, because there are definitely some challenges and areas that we need to work on, and just wanting to be a voice of providing that information. I got started in podcasts specifically because of Serial. Like, I'm a podcast junkie, and if anybody has not ever listened to Serial season 1, that's probably some of the best podcasting that has ever been made. I was like, oh, maybe I can do a podcast. Not quite like that, but here we are.
Well, it's funny you say that about Serial because that was the first podcast I ever listened to, although I think I may have started with season 2. I can't remember which is which, season 2, and then went back to season 1. And I would say still to this day, I have never been as captivated by a podcast as I was by those 2 seasons.
Yes, it is without question like one of the best podcast series ever made, if not the best.
It actually made things happen. I mean, it wasn't just... Anyway,
exactly.
We could go on and on, but I agree to all of the listeners, if you have not listened to the first 2 seasons of Serial, and I think I just saw a headline yesterday that a new season is going to be coming out.
Okay. All right. Well, I'll have to listen for sure.
And so as you were talking, I was thinking, I guess your podcast could have been an avenue, and you can correct me if I'm wrong, that gave you a chance to share information that maybe you didn't have time for in each individual appointment. Because I know when I talk to pediatricians, a lot of times they'll say, yes, we're sending you this patient. We need you to help them. We don't have that time in each of these individual appointments. So did it provide an outlet for you to share all the things you wish you could say in every single appointment?
1000%. I mean, it was really about giving information in a way that also that people could wanted to receive it. Like those pamphlets and things that get handed out, nobody really actually reads them or looks at them. So it was about delivering information in a way that was good for people to consume it. And yes, in like 5-10 minute, maybe 15-minute visits, it's impossible to cover everything. So absolutely.
Well, I'm so grateful for all the work you do supporting women and specifically new moms. And I know today we're discussing what can be a heavy topic, but I'm grateful to be able to have this conversation with an OBGYN so that expecting and new moms can hear it from you, because those are the folks that they're dealing with most often. Mm-hmm. So before and even when I was struggling with postpartum anxiety, I have to admit, I never really thought of the OBGYNs as playing an important role in maternal mental health. But after recovering from my own postpartum anxiety and having worked with over 1,000 moms and hearing their experience, I've really come to believe that they actually play a critical role. But I'm curious in this role that maybe they didn't know they were signing up for when you're in medical school and thinking, I'm going to deliver all these healthy babies and help these women have smooth deliveries. Is it actually a part of your medical training? Can you share what, if any, specific training in medical school you receive around this topic?
Yeah, so not a lot. And there's still not a lot. So, and I've been out in practice for a long time. So I've been out for 20 years, but things aren't a whole lot different, unfortunately. Yes, there's a lot more awareness about it, but not necessarily like deep, extensive treatment options for postpartum depression, postpartum anxiety, or even depression during pregnancy. So we do have a lot of awareness about it. And there's definitely like awareness about how we play a role with screening for sure. So that has definitely changed, but it's not a ton of information, to be honest.
And so I think that's tricky because I think a lot of us are starting to believe you need to play a critical role, but it might be an unreasonable expectation. And so I'm curious what role you think the OBGYNs should play in a mother's perinatal postpartum mental health.
Yeah, definitely screening to look for any potential problems. But that's also tricky because for most people, you're not going to see your OBGYN for 6 weeks. And there's a lot that happens within those 6 weeks. And that's where pediatricians play a role with screening as well. So definitely screening. And we can certainly do some basic treatment options, at least medication-based treatment options for sure. But really the role of the OBGYN should be to connect people with other services, because we are not the ones who are going to primarily treat this on a long-term basis. We really should be able to connect people with the services in our local communities or even larger communities. That's where so screening and connecting to services are the two biggest areas. It's not going to be so much about treatment.
Okay. And I'm curious to hear if there was a moment or an experience you had either as a practicing OBGYN or even as you became a mother that really started to shift how you felt about maternal mental health and the experience of the mother. Obviously, it's an area you care about. Was there kind of that defining moment where you realized women need more and I'm going to play a role in it?
Yeah, definitely for me personally, I'm realizing, and actually, it was in hindsight more realizing how common postpartum anxiety is. My first daughter was born 8 weeks premature, and she was in the NICU and for a month, and she had to have surgery 3 days after she was born. She had a rare intestinal malformation. She's totally fine now. She's 16, actually, just on her way to Spain for a school trip. So I'm like having anxiety about that. So
that's big.
Yes, but at that time, I didn't. We weren't even really like talking about postpartum anxiety as an issue. And then just in the course of doing my podcast, it was like, oh, postpartum anxiety. And I have since learned that it's actually more common these days, particularly even than postpartum depression. A lot of that has to do with social media and the ways that we are connected that aren't always so helpful. Mm-hmm. So for me, it's just been learning that it's great that we talk about postpartum depression, but we also need to talk about postpartum anxiety. And the other thing for me is just being honest with people that your OBGYN is not going to be the one who's likely going to treat your mental health concerns surrounding pregnancy and postpartum. That's just the reality. It's not what we're taught to do. We're taught to screen, but treatment is not as good. And we have to, so don't expect that you're suddenly going to get like tons of answers or necessarily tons of help. So often people feel let down maybe, or even disappointed because they're going to go to their OBGYN and their OBGYN is going to say, well, you should see a therapist, or you should see a psychiatrist, or you should see, which I think is appropriate because those are the people who can treat. Mm-hmm. It's the problem is that next step can be very challenging for people, yes. Whether it is insurance, whether who is in the community, whether it's trying to get the baby to an appointment, whether it's like, is there anybody even available near me? That next step can be so challenging. But it's important that we have our eyes wide open about what it's going to be like. And the reality is your OBGYN is not necessarily going to be the person who helps treat your mental health concerns. And that's just the reality of things.
Okay. And do you recommend as a first step that someone confide in their OBGYN at a checkup? Absolutely. Is that an appropriate step?
Absolutely, you should. Absolutely, you should. I do think on the other side, sometimes we struggle, though, with what to do with that information. Mm-hmm. So we screen for it and we say, okay, you should maybe see a therapist. If someone's in imminent danger, like they have a really high score on the depression score, then we may send people to the emergency room, even like that. Mm-hmm. But it's going to be a lot of look for a therapist. Here's information about a postpartum support group. Here's information you can call. So definitely talk about it because that's a reasonable first step. But you may also need to look for some options on your own. I think Postpartum Support International is a great website that can connect you with resources in your community, whether it's in person or telehealth or groups or, support groups, all of those kinds of things. So I always recommend that as a great website resource as well, especially for people who, it can be hard to take your baby out and all of those sort of things. Totally. And they provide a wide range of support. So that's what I would say for that.
And I'd love to talk a little bit about the screening test. As you mentioned it, I thought, let's dive into that. I also struggled with postpartum anxiety, and I don't think I fully appreciated it until I got to the other side. And I could look back, and it was like, ooh, that's kind of scary, the things I thought and the pressure I felt. But does that screening, I'm thinking of the little piece of paper they gave me on the clipboard, is that just screening for postpartum depression, or does it also screen for postpartum anxiety?
Depression.
So I think that's interesting. And I had not thought about it until you were speaking, that's a big gap. We're leaving a lot of people out that could use some help that aren't even getting caught in that screening.
You have nailed it on the head. We don't talk about, and it's important to talk about postpartum depression, and we've talked about it a lot more, but we really need to start talking about postpartum anxiety. I had a psychiatrist on my podcast recently, and she said that that's like more of what she sees, and we're not necessarily looking for it. It's those like, am I doing this right? You got to check on the baby constantly. you're worried that something's going to happen, that screening is really designed for depression. Important, but we don't necessarily screen for anxiety.
Right. Because I remember thinking, there was like, are you able to care for your baby?
Mm-hmm.
Yes. I was like thinking about hurting anyone. No. Do I feel like a hot mess who has visions of crashing my car? Yes. Am I having those weird thoughts when I drive? Yes, I am.
That was one of the things that I discussed on my podcast with the psychiatrist who specializes in perinatal mental health, those intrusive thoughts that you realize that's not, and I don't know for your own particular instance, how common that is to have those types of thoughts. But the difference is you know that you're not supposed to be having those, like, you know, something is is not right, but you're still having these thoughts. Like, that's a hallmark of postpartum anxiety.
Right. And it's a wild ride. So that's interesting. So then you have the potential struggle. I've had people tell me that they have been dishonest on the screening because they're scared what would happen to be honest on that. And so I'm curious how big of an issue you think that is. And then now we know we have the gap where that screening's not even catching the more typical postpartum anxiety. How often do you feel that women, whether it be, I shouldn't tell someone that I'm having visions of crashing my car, and I definitely shouldn't answer these questions appropriately. How big of an issue do you think that is? Or is it hard to know?
It's hard to know, but I honestly, I find that people tend to be fairly honest on those assessments. Sometimes it's like you get the responses and you're like, oh, wow, you didn't see that it was necessarily that people are necessarily struggling. So for a good number of people, it's like, this is the opportunity to speak up and kind of ask for help. But it is hard to know how many people in hindsight, and we may not always know, like, who answered the questions just because they were answering what they thought was the right way, so to speak, because we're not necessarily going to see that follow up afterwards. So it's a hard thing to know.
Right. And I think that many expecting and new moms might be struggling in a similar way that I was, where they don't even really appreciate the struggle that they're in. So let's just take anxiety specifically. So it's not that they're being dishonest or covering it up. They filled out the questionnaire. No one flags anything. And they know it's weird that I'm thinking my car is about to go off the road and hit the tree. But they're so in it. I felt like what I realized was I was so in it that I couldn't see it clearly. What do you do when you know someone's struggling and you can tell in the appointment? You can see it, but they are not volunteering that up. Do you have thoughts on how to broach that subject?
Yeah, so the best we can ask is, and I tend to find that honesty is always the best policy. And like straightforward, honest, and just directly ask, you know, and I even can relate it to my own experiences.
Yes.
You know, it looks like you're having some difficulty with being postpartum. Are you having any thoughts or trouble with anxiety? Or I'll even say, you know, maybe you look a little bit like you're tired to me. Are you able to get some sleep or some rest? Are there things that are interrupting? I really base it on what the person looks like and just be honest and say that I'm concerned, and also normalize it for sure, because it's totally normal. It's so normal that people feel this way. We don't always talk about it enough, but there are some resources that we can connect you with that can help you.
Yeah, I find I approach it similarly with my clients when I'm talking to a mom about their child's sleep, but I can just sense it bubbling up. And I also approach it that way with, I share my experience, like, oh, I'm sensing something from you. It's reminding me of how I felt.
Right.
And then the other struggle, because I've interviewed husbands who have had wives who struggled with postpartum anxiety and or depression, and a common theme is they feel helpless. Those were specific words I heard from multiple partners. I knew something wasn't right. I felt helpless in a way that I couldn't help them. Do you have thoughts on how a loved one, whether it be a mother's parent who comes in and it's like, oh, this isn't right, or a partner, or even a good friend, do you have any thoughts or advice on broaching the subject? Would you do it the same way that you just said?
Yeah, I think the same way. I'm just concerned. It looks like things are a little bit challenging and I want to be able to help. Let's find some resources together that can help, because it doesn't have to be so hard. It doesn't yet, or I should say there should be some joy. Like, you shouldn't be sad all of the time after you have a baby. That's a red flag that something is not right in the process. So again, same thing. Honesty, I think, is always the best policy and approach. And you can say, hey, do you want to make an appointment with your doctor? Or, hey, let's look online for some resources, because there's so many resources and things. And then for people who are wanting to check on someone, it's likely not going to be a one-time thing. You're going to have to ask, and then maybe you see, and you may have to ask again. You don't want to be pushy or anything like that, but just check with people a couple of times, because sometimes it takes people a little bit of time to come around. All you can do is you can control your behavior and what you do. I think you'll always regret not helping someone when it looks like they are struggling, even if that conversation is difficult. Now, you may not be able to, and you're not going to be able to decide what that person does, or if they accept your help, or if they want to talk about it. But the best you can do is open your heart, speak with your heart, and open yourself up to help and show your concern.
Mm-hmm. Yeah, one approach I take with friends or the women I come in contact with out in the real world who are expecting is I try to proactively share my experience, because my hope always is, and I have had one friend report back to me saying, I felt so much relief by knowing your story when I started to feel completely out of control.
Right.
Because I had that moment of saying, oh, this is like what Allison said happened to her. And so I think the more that women share their own stories, it can help people see it in themselves a little bit as well.
Definitely. Absolutely. Absolutely.
Would you ever recommend, if a partner feels like they're not getting through, would you ever recommend they reach out to a woman's OBGYN, or what would be their next resource?
Yeah, I think that's a reasonable thing to do. And then they can just help you talk through what some options may be. Like, maybe your OBGYN can then call that, like, if the husband or partner calls in, then maybe the nurse or the OBGYN could just say, hey, I'm just calling to check, see how things are going. Maybe you should come in for a checkup, those kinds of things. So that's definitely a reasonable step to take.
Awesome. And I think the other thing, I work with a lot of, I would say, high achieving type A women. And if someone's listening today and thinking, I'm not sure if I'm feeling bad enough that we would classify it as postpartum anxiety or depression, and I don't want to be overly dramatic if I don't technically have one of these, but I don't feel like myself. I feel like this is totally your wheelhouse. What is your advice for that mom?
It never hurts to even just have a conversation with someone, to talk through what you're feeling, talk through how things are, and help provide an outside and unbiased perspective. You very well may find that they say, you know what, you're right. This is actually on the realm of normal. Yes, you're having some challenges. Here are some strategies that can help you deal with things. Or they may say, this is actually pretty serious. So we need to get you on a regular schedule of therapy, find a psychiatrist, maybe consider medication, all of those kinds of things. So it never hurts to have that one visit to at least get a sense and an outside perspective from someone about what may be going on.
Yeah. And I think this is true for all fields, but not everyone is going to be perfect at navigating all aspects of the job, particularly when they aren't trained for it. So not every OBGYN is going to be great at helping a mom who's struggling, identifying them, or even responding to struggles they share. So if a mom is trying to tell or has told their OBGYN that she's struggling, but she doesn't feel like she's being heard or guided to the help she needs, is your advice there to then do the Postpartum Support International and to start kind of an online look for resources?
Yes, because they'll connect you with places that are local to you. So, you know, I don't want to be like completely doom and gloom and say like, you know, everything is so bad, it's so terrible. But the reality is that yes, sometimes we're not listening, or sometimes even we listen and then you go see that therapist and you're like, me and that person are not clicking. Like this is not working. So it may require that you have to do a little bit more it may take 2 steps, 3 steps, try one therapist, try another one before you find that fit and that connection. But just know that you are worth it, the effort. And it is worth the effort to keep working on it, because you deserve to feel happiness, to feel joy, to feel great in that period of time. And just like it typically doesn't come on like all of a sudden that, you know, things sort of build up. Same thing about getting it to ramp down. It's not going to suddenly overnight after one visit be better. Things will get a little bit better, a little bit better, a little bit better until you're like, you know, I feel like I'm in such a better place. So just you're worth it and keep working at it. So if that first OBGYN is not listening to you and you're like, this isn't working, then keep going until you find something that is helpful for you.
And this is where, as you were talking, I thought this is where a partner can be helpful, because you are so right that it's not always going to be the first person that does help you that you find. The first therapist or counselor may not be the right fit. And so if a partner can say, hey, I did some research. Here are 4 options.
Yep, exactly.
Let's start through that process.
Yes.
And I've shared this story before, but my father was the one who really brought it to my attention that I was struggling. And he said it one night at dinner, and I'm sure it made him uncomfortable. He's not really a emotions type of guy, but he said, we are worried about you. You don't seem like yourself, is what he said. And I remember my response was, I don't feel like myself. It was like I kind of finally had permission to say I don't. And then he had to point out to me the fact that, and this is where kind of the dad tough love, he said, you are a lucky person. You have resources. You have an education. You can get help. And then he kind of went on to, there's so many people who don't have resources. You do, like, take action. You have to do something. And that's what prompted me. Actually, that was kind of how I ended up in this business. First thing I said was, I need to get this child sleeping. I have to figure out sleep. And so we hired a sleep coach, and then I could start to see my way out a little bit. But he was the first person who said, we don't feel like you're acting like yourself.
Oh, that is interesting.
Yeah.
How long after, like, where were you in the postpartum journey?
Well, it kind of ended up being a 2-year one, because my children are only 18 months apart. And I don't think I had come out of it. And actually, my OBGYN during my second pregnancy, so I had issues during that pregnancy, both pregnancies. The triggering one was my first pregnancy. I went for that first ultrasound or second ultrasound. They said, oh, you have a tumor. And so that sent me into a tizzy. So that was lots of anxiety around that.
Just a lot, yes.
And then I came out of that. Then I got pregnant quite quickly, still baby not sleeping. And then I started to have weird anxiety. Like, I remember at one appointment, my husband was there, I said, can we do a tick check? I think I'm very worried I'm going to get Lyme disease because we moved here from Chicago and Lyme disease isn't a thing. And I just read something. And I went on this whole tangent on I was going to get Lyme disease. And I remember the OBGYN said with a little bit of a chuckle, have you ever been professionally treated for anxiety? And I said, no. And then he and my husband both kind of laughed, and that was the end of it. And I always think if we could turn back time, he should have really pushed me on that. He should have said, what you're saying right now,
I'm concerned,
is a class, or he should have said something to my husband, like, she's struggling. And so I play that back now. I'm like, oh, he had a moment right there to say, these thoughts aren't correct. So then I had my daughter, and so it was when my first daughter was about to turn 2. She was about 23 months old. And my other daughter was, 5 months. And he said, and I really was at a breaking point. I was probably at that point not in a good place. And but it was a real turning point. It was the moment we came back and I said, I've got to do something. And by the end of January, I was in a much better place. But it did kind of take, because we had actually talked to a sleep coach. We were kind of unsure. And it took him prodding, because I remember what I did say is, I'm so tired that I just read a news story about a woman who had driven her car into a lake with 4 kids in the back. And I said, I'm so tired. And I just read this story, and all I can think is, I bet that woman's so tired. And my dad said, wow, okay, let's move this along. If you feel like you can relate to being that tired, then you need to get some help to get sleep. But I do think sometimes it does take someone, I don't know. I don't think he knew what. If I said to him now, did you know I had postpartum anxiety? He'd say, no, did you?
Like, what? Yeah.
He probably still doesn't know. He'd just probably say, you seemed weird. Something doesn't seem right. But I do sometimes think it's important for people to say something.
Yeah, I agree. Definitely. I agree. And again, these are things that can feel awkward. And you can even say, like, these words may not come out right. I don't know if I'm saying this exactly right, but I'm just telling you from my heart that I'm concerned and that you don't seem like yourself. And just when you lead that way, that's the best you can do. All we can control is our own behavior and the things that we can do and the way that we present ourselves in the world and how we approach our own lives. And I think you'll feel better if you see someone struggling and you speak up.
Absolutely.
Yeah.
Well, Dr. Nicole, this has been so helpful. Before we wrap up, what is one thing that you just wish every expecting and new mom knew as it relates to her mental health and well-being?
I would say that know that you deserve happiness and joy. The world can be a very challenging place, and sometimes even you feel out of a sense of like, oh my gosh, there's so many people struggling. Should I really be happy? All of those things, especially for like high achieving, that kind of thing. But you absolutely deserve to feel happiness. You deserve to feel joy in your life. So please remember that.
I love that. Well, thank you so much for joining me today. Can you tell everyone how they can find you?
Yes, I am everywhere at Dr. Nicole Rankins. So Instagram at Dr. Nicole Rankins. My website is drnicolerankins.com. And my podcast is called All About Pregnancy and Birth.
I love it. And we will link to all of those in the show notes. Thanks again for joining me. And thank you so much for the work you do supporting moms.
Thank you so much. I hope the information was helpful. Like I said, sometimes I feel like it's a little bit of doom and gloom, but I just want to be honest about the resources and things that are available and know that there are things out there to help so you can feel better.
I believe knowledge is power. And
absolutely.
So I think it's helpful for people to just hear the truth so that they can make educated decisions based on what's reasonable to expect.
Absolutely.
All right. Talk to you soon. Bye for now. Thank you for listening to How Long Till Bedtime. To learn how we can work together to improve your child's sleep, please visit sleepandwellnesscoach.com.